By the end of Module 7, you will be able to understand the principles and goals of palliative and end-of-life care, identify signs of imminent death and transition patients to comfort care, facilitate advanced care planning and document EOL decisions ethically, manage physical, emotional, and spiritual symptoms of dying patients, communicate compassionately and sensitively with patients and families at the end of life. End of life EOL care is a specialized domain in geriatrics that seeks to provide physical, emotional, psychosocial, and spiritual support to individuals who are nearing the end of their life. It is a person-centered, holistic, and dignified approach designed to relieve suffering, preserve autonomy, and honor patient values. This module explores the principles, practices, legal frameworks, and ethical challenges of delivering quality EOL care to elderly individuals. It introduces you to palliative care models, symptom management, emotional support for families, and the process of advanced care planning, ACP. Importantly, it emphasizes cultural competence, communication skills, and interdisciplinary collaboration in terminal care. Whether in homes, hospices, care facilities, or hospitals, this module prepares caregivers, nurses, and healthcare providers to handle EOL scenarios with compassion, clarity, and professionalism, ensuring dignity in dying and comfort in caregiving. Understanding end-of-life and palliative care in the elderly. Definition of end-of-life care: care provided in the last year, months, weeks, or days of life. Palliative care: symptom-focused, holistic support that may begin alongside curative treatments, especially for chronic illnesses, e.g. cancer, dementia, heart failure. Goals: relief of pain and discomfort, psychosocial support for patient and family, spiritual care to address existential suffering, facilitating peaceful and dignified death, recognizing the dying process and transition to EOL care, physical indicators, declining appetite, confusion, weakness, labored breathing, changes in vital signs and consciousness, emotional and spiritual indicators, withdrawal from surroundings, emotional distress or unresolved conflicts, importance of timely transition from curative to comfort care to avoid overtreatment. Advanced Care Planning, ACP. ACP is a structured conversation between patients, families, and healthcare teams to document a person's future healthcare preferences in case they become unable to make decisions. Includes advanced directives, living wills, specify types of treatment, e.g. DNR, feeding tubes, lasting power of attorney, LPA, legally appoint someone to make decisions, do not resuscitate, DNR, orders goals of care conversations. ACP ensures respect for autonomy, minimization of family conflict, reduced unnecessary hospitalization, legally protected clinical decisions. Pain and symptom management in EOL. Pain, managed using WHO pain ladder, stepwise use of paracetamol, opioids, adjuvants. Other symptoms: dyspnea, opioids, oxygen, positioning, nausea, vomiting, antiemetics, ondansetron, haloperidol, constipation, stool softeners, hydration, anxiety, agitation, benzodiazepines, therapeutic touch, non-pharmacologic strategies, music therapy, massage, aromatherapy, spiritual and emotional support. Acknowledge and respect diverse religious beliefs and end-of-life rituals. Offer access to chaplains, counselors, or cultural elders. Validate grief, fear, and regrets of patients and families. Provide bereavement support pre- and post-death. Communication and cultural competence. Use of clear, empathetic, and honest communication when discussing prognosis. Training in breaking bad news, SPIKES protocol. Cultural sensitivity regarding death taboos, family decision-making roles, preferences around resuscitation, organ donation, and burial practices. Ethical and legal dimensions of EOL care principles. Autonomy, honoring patient wishes. Beneficence, doing good. Non-maleficence, avoiding harm. Justice, fairness in care. Dilemmas, refusal of treatment. Assisted dying, where legal. Family disagreements versus patient autonomy. Legal protection for clinicians following documented directives. Role of the multidisciplinary team, MDT. Physicians, diagnosis, prescriptions, prognosis discussions. Nurses, bedside monitoring, comfort provision. Social workers, support with legal forms, grief counseling. Chaplains, spiritual leaders, spiritual guidance. Care assistants, hygiene, mobility, companionship. Home-based versus institutional EOL care. Hospice care, specialized centers for end-of-life comfort. Home-based palliative care. Preference for most elderly people. Advantages: familiar environment, family presence, reduced medicalization of dying, post-death procedures and grief support. Confirming and documenting death. Notification to authorities and family. Cultural and religious rights. Body care and transportation. Supporting family through the grieving process, including children. Referral to bereavement services and grief therapists.